The world is facing a silent epidemic, one that casts a long shadow over global health. This is the epidemic of overweight and obesity, a growing concern that affects millions worldwide. No longer a problem confined to developed nations, obesity has spread its reach to every corner of the globe, impacting both developed and developing countries alike. This complex issue demands our attention, as its implications reach far beyond individual health, affecting healthcare systems, economies, and societies at large. This essay will delve into the multifaceted issue of obesity, examining its global prevalence, health implications, and underlying causes. We will explore the social and economic disparities that fuel this epidemic and discuss effective public health responses. Finally, we will emphasize the need for collaborative efforts to combat obesity, advocating for a comprehensive approach that involves individuals, communities, and policymakers alike. The statistics paint a stark picture of the global obesity crisis. Over 1 billion people worldwide are living with obesity, a number that has tripled since 1975. This alarming trend is mirrored in children and adolescents, with 20% of this demographic now classified as overweight or obese. These figures represent a significant increase from just a few decades ago, highlighting the rapid growth of this global health threat. The World Health Organization estimates that over 1 in 6 adolescents are overweight or obese, a statistic that varies across regions but points to a widespread problem. The United States, in particular, has seen a dramatic surge in obesity rates, with over 40% of adults now classified as obese. This alarming statistic underscores the severity of the issue, particularly in developed nations where lifestyle factors play a significant role. This global health crisis is not merely a matter of numbers. It represents millions of lives at risk of developing serious health conditions. It is a stark reminder of the urgent need to address the root causes of obesity and implement effective strategies for prevention and management. The time to act is now, before the consequences of inaction become even more dire. The health implications of being overweight or obese are far-reaching and extend beyond the physical realm. While the physical consequences like heart disease, type 2 diabetes, and certain types of cancer are well documented, the mental and social health impacts are often overlooked. Obesity increases the risk of developing a myriad of health problems, compromising overall well-being, and leading to a diminished quality of life. Physically, obesity places a significant strain on the body's systems. The cardiovascular system is particularly vulnerable, with obese individuals at an increased risk of heart disease, stroke, and high blood pressure. The metabolic system is also impacted, leading to an increased risk of developing type 2 diabetes, a chronic condition that affects millions worldwide. Mentally, the social stigma and discrimination often associated with obesity can take a toll on an individual's self-esteem and mental well-being. This can lead to social isolation, anxiety, and depression, further exacerbating the challenges faced by individuals struggling with their weight. The psychological burden of obesity can be just as debilitating as its physical effects, highlighting the need for a holistic approach to address this complex issue. While obesity affects people of all backgrounds, it does not do so equally. Stark disparities exist in obesity rates across different socioeconomic groups, highlighting the role of social determinants of health in fueling this epidemic. Lower-income communities and marginalized populations often bear a disproportionate burden of obesity, facing systemic barriers to healthy living that contribute to this complex issue. Studies have shown a clear link between poverty and obesity, with lower-income neighborhoods often lacking access to affordable, nutritious food. These food deserts are characterized by a high density of fast food restaurants and convenience stores selling processed, calorie-dense foods, making it challenging for residents to make healthy dietary choices. Furthermore, limited access to safe spaces for physical activity, coupled with the high cost of gym memberships and fitness programs, creates additional barriers to a healthy lifestyle. Addressing these socioeconomic disparities is crucial to tackling the obesity epidemic effectively. Public health interventions must focus on creating equitable access to healthy food options and opportunities for physical activity, ensuring that everyone has a fair chance to achieve and maintain a healthy weight. Section 5. Unraveling the web causes of the obesity epidemic. The obesity epidemic is a complex issue with no single cause. Rather, it is the result of a complex interplay of genetic, environmental, social, and economic factors that contribute to an individual's risk of developing obesity. Understanding these multifactorial causes is crucial for developing effective prevention and intervention strategies. Genetics undoubtedly plays a role in an individual's predisposition to obesity. However, genes alone do not explain the rapid rise in obesity rates observed in recent decades. Environmental factors, particularly the obesogenic environments we live in, have significantly contributed to this trend. These environments are characterized by an abundance of calorie-dense, processed foods and a decline in opportunities for physical activity. Social and economic factors also play a significant role. As discussed earlier, lower-income communities often lack access to affordable, healthy food options and safe spaces for physical activity. Cultural norms and beliefs surrounding food and body image can also influence dietary habits and physical activity levels. Section 6. Combating obesity, a public health imperative. Addressing the obesity epidemic requires a multifaceted public health approach that targets multiple levels of influence. This includes individual-level interventions, such as promoting healthy lifestyle choices through education and awareness campaigns, as well as population-level strategies, such as policy changes aimed at creating healthier food environments and promoting physical activity. Educating individuals about the importance of a balanced diet and regular physical activity is crucial. This can be achieved through school-based programs, community workshops, and public health campaigns. Providing individuals with the knowledge and skills to make healthy choices is essential for empowering them to take control of their health. However, individual-level interventions alone are not enough. Creating supportive environments that make healthy choices easier and more accessible is equally important. This requires a collaborative effort between policymakers, communities, and individuals. Section 7. Towards a healthier tomorrow, policy changes for a healthier society. Policy changes are essential for creating supportive environments that encourage healthy lifestyles. Governments can play a crucial role in shaping food environments by implementing policies that promote healthier food choices and limit the marketing of unhealthy foods, particularly to children. Taxing sugary drinks, for example, has been shown to be an effective strategy for reducing consumption. Similarly, restricting the marketing of unhealthy foods to children can help to shape healthier dietary habits from a young age. Governments can also incentivize grocery stores to open in underserved communities, increasing access to fresh, affordable produce. Beyond food policies, investing in infrastructure that promotes physical activity is crucial. This includes creating safe and accessible parks, bike lanes, and pedestrian walkways, making it easier and more enjoyable for people to incorporate physical activity into their daily lives. By creating environments that support healthy choices, we can nudge individuals towards healthier lifestyles and curb the obesity epidemic. Section 8. Empowering communities' grassroots efforts for change. While policy changes are essential, community-based initiatives are equally crucial for creating sustainable change. Empowering communities to take ownership of their health and well-being can foster a sense of collective responsibility and lead to lasting change. Community gardens, for example, can increase access to fresh produce and promote healthy eating habits. Community kitchens can provide opportunities for residents to learn how to cook nutritious meals on a budget. Organizing community fitness events, such as walks and runs, can encourage physical activity and foster a sense of community. These grassroots efforts, driven by community members themselves, can be incredibly effective in creating lasting change. By addressing the unique needs and challenges of their communities, these initiatives can create culturally tailored solutions that resonate with residents and promote healthy lifestyles. Section 9. A collective responsibility, shaping a healthier future. The obesity epidemic is a complex challenge that demands a comprehensive and collaborative response. It is not a problem that can be solved by individuals, communities, or policymakers alone. Rather, it requires a collective effort, with each stakeholder playing a crucial role in shaping a healthier future. By working together, we can create environments that support healthy lifestyles, empower individuals to make informed choices, and reduce the burden of obesity on individuals, families, and healthcare systems. The time to act is now. Let us work together to create a healthier and brighter future for all.